Thank you. So for today, a couple of announcements. One, of course, is that we have a new case of coronavirus, COVID-19, who was diagnosed in a close contact of case 6, which we reported last week. This is a man in his 40s who's also in the Fraser Health region. He had onset of symptoms prior to case 6 diagnosis, so we've been working very diligently over the weekend with Fraser Health to identify anybody that he came in contact with prior to going into isolation last week. So there have been a number of close contacts that have been connected with by Fraser Health over the weekend, and they are also in isolation now and being monitored actively every day by public health. His condition is stable and he is in isolation at home. Just to give an update on our other cases, so case 6 as well is in stable condition. She was and also in isolation at home and is recovering. The number of close contacts that we identified from her travel, particularly on an airplane and in the community last week, have all been connected with, and so far there have been no other additional people who have shown any symptoms. On a positive note, we know that our first case has recovered. Our second, third, and fourth cases, which were a cluster in a common household in the Vancouver coastal region, are also recovering, and we're expecting them to have testing this week to confirm that they have indeed recovered from the virus. And additionally, the fifth case in the Interior Health Authority is also doing well and is no longer symptomatic and will be tested again this week to see if she has fully recovered. There have been no additional cases identified from any of the contacts from the initial 5 cases that we identified previously. So I think this is a rapidly evolving situation. There was a lot of work done over the weekend to try and identify anybody who might have been in contact with our last 2 cases. And I think it's important to say that there is no need for anybody in the public to go in for testing unless you have been contacted by public health. We are confident that we know the people who are at risk, and those people have been identified, and we know that there's been quite a lot of concern in a number of communities and a number of school communities, and we can say that Fraser Health and Vancouver Coastal Health have been working diligently to ensure that anybody who is at risk from contact with either of these last 2 cases has been identified